Well, as the weather gets colder, cases of COVID-19 are beginning to tick up again. According to the CDC, COVID-related hospitalizations are up 7.7% in the latest week of data. Now, the Biden administration is bringing back the free testing kits. Here with the details, we've got Yahoo Finance reporter Anjalee Khemlani. Anjalee, what do we know so far?
Well, Brad, we know that, of course, the government has announced yesterday that they're going to restart mailing free COVID tests to whoever signs up for them. And that starts on September 25th. And that is the fifth round of free tests that the government has decided to disperse in time for this winter wave. As you mentioned, we have already seen hospitalizations ticking up, some states more than others, Florida seeing quite an increase there. And we do know that, of course, the EG5 variant is the one that is currently dominating and causing these hospitalizations and some concerns. It now accounts for about 25% of cases. The government has also announced that they're going to be dispersing $600 million to fund this effort, and that includes a dozen companies that are going to be producing up to 200 million tests for the government to get added to their stockpile. So, while we are seeing this move, there has also been some concern about not enough being done to help with the coming wave. We know that the vaccine boosters have already been approved in most cases. We're still waiting on word from Novavax, but at least the two mRNA options are out there. There have been some struggles to gain access to those with the rollout, so that's a concern. Meanwhile, mask mandates, varying levels around the country. So it's a little bit of a mixed bag picture when it comes to how the country is responding to an anticipated increase, as we just saw at the tail end of the summer, a slight uptick in cases. Experts do anticipate that there will be a greater uptick through the winter months with these new variants.
Do we know anything about the severity of this strain? And when we talk about these shots being available, in terms of the uptake, because we heard some projections from Pfizer and Moderna earlier this week, what does that look like as we look ahead to the coming months?
Yeah, the severity is different. Of course, we have a slightly immune population, at least having some level of protection with vaccines or previous infection or a combination, and that provides a higher level. So most people are largely protected from severe cases. However, those that are most vulnerable do need to get those boosters in order to really increase, their protection levels against severity. But we are seeing those upticks in hospitalizations because there are still people who are not protected or whose protection has waned significantly over time. And so, to that question about the severity of the strain itself, we've definitely seen a shift in how COVID is presenting. Earlier on, fever used to be the one telltale sign, and that's not necessarily the case anymore. It has been a little bit less severe in terms of those symptoms, coughing, a little bit of a heavy chest, maybe a little bit of congestion. Those are some of the newer symptoms that are sort of the telltale sign now. I can tell you, having been in a household with people who just got it, so have a little bit of personal expertise there. But yes, to the point of, what will the demand be for these vaccines? That still remains to be seen, whether or not people are taking this rise in cases seriously, whether or not it is, significant enough, and whether or not other variants show up by the time the winter months come around, because we could still see a rise in something else until then.